Facts about number needed to treat. The lower the number of the NNT, the more effect the intervention has. NNT is able to compare an intervention to another intervention or a placebo, though when two active drugs are compared, the NNT will be much higher than if a drug is compared to a placebo. The NNT is time-dependent. The longer a clinical trial is conducted, the more likely the chance of the condition to respond, resulting in a smaller NNT. Also, the longer a patient is taking a medication, the more likely they are to respond. An example of this is an antidepressant having an NNT of 79 after 1 week of patients taking the meds versus an NNT of 6 after 9 weeks. Healthcare professionals and patients need to consider the study criteria when assessing NNT. The participants in a study may be different from the patients being treated. For example, if a patient being treated is healthier than the study participant, the NNT would be lower. Conversely, a patient's condition is more severe, the NNT would be higher. The baseline risk or the severity of the condition is another consideration. Take blood pressure, for example. The NNT to prevent one death, stroke, or myocardial infarction in a 5-year period has an NNT of 141 for mild hypertension, but has an NNT of 3 for severe hypertension. NNT is better at describing dichotomous data, but it can be used to look at scores on a continuous scale. A condition like pain can be analysed by establishing cutoff points, like comparing moderate to severe pain versus mild to none. NNT assists healthcare professionals when evaluating the cost, side effects, treatment impacts, or resources available. Minor conditions might not be treated if the costs and side effects of an intervention are high, even if it has a low NNT, whereas serious illness may still be treated even if it has a high NNT if the costs are low and the side effects are minimal. NNT can be a useful clinical tool for patients and healthcare professionals alike, helping to judge if an intervention is worthwhile.
Created using Powtoon.